Another big passion for me is acne scarring. So I do a lot of acne scarring corrections. I believe that I do better work than most people out there because they just don't have the passion to fix acne scarring. Acne scars, there's so many types of acne scars. There are rolling types, there are ice picks types, there are boxcar types. These are categories that are very confusing when you hear about them. But the perfect candidate for me to get good results is a little bit of a softer shoulder. When that shoulder of the acne scar is a V-shape or a boxcar, it's harder for me to get that result improved. Let me start with a basic philosophical difference of what I do versus other people. The vast majority of people out there are trying to level the normal skin down to the abnormal skin through dermabrasion, laser technology, things like that. They're trying to bring down that normal skin to the whole. I think this is really difficult to do, to take normal skin and bring it down to atrophic abnormal skin. What I'm trying to do is take the abnormal skin and elevate it as close as I can to the normal skin. And at that point, if we're really close, but there's a little beveling at the edge that's not quite fixed, that's when I pull out a possible dermabrasion, laser, other things, just to finesse that edge. But I'm not going to really talk about lasers in this video. What I'm really going to focus on is the techniques that have worked for me over the last 20 years. My principal mechanism that I use to help deliver the results I get is microsilicone injections. The silicone is Silicone 1000, very purified. We draw it up sterilely. It is injected. It is off-label, which means totally legal, totally appropriate if the doctor is telling you the pros, cons, limitations of the procedure. But I use silicone. It's permanent. I've done it for 20 years. People have asked me just the other day, how's it age for someone? Well, I trained with someone who did it for 45 years before he passed away. I've done it for 20 years. I have seen great, safe, long-term results with really minimal to no complication rate. But the biggest complication you'll see online is Granuloma Formation. Essentially what that is an infection of the material. Unfortunately, I've never seen that. I think that the reason for this is besides the pure grade silicone that I'm using, it's also how I distribute it, how I clean the patient, and where I inject it. It doesn't mean that you can't have an infection in the material. It's always a possibility, but I've never seen it. Where I see the risk of granuloma formation is in patients that have lips. I do a ton of lip reductions. You can watch my video virtual consultation on that. Silicone and lips, terrible. I think over time it just becomes a problem. People bite on it, there's traumatic issues to it, and it just changes the shape. So silicone and lips, terrible. Don't do it there, ever, in my opinion. Other things are these, transgender, other patients are doing huge butt injection silicone, very dangerous. Large volume silicone's unsafe. If you look historically, where the breast implant issues were problematic with these really large volumes of silicone placed into breast tissues, that's unsafe. But silicone, smooth silicone gels or cohesive gels can be safe. I'm speaking out of my specific realm of specialty because I'm really talking about acne scarring. But silicone's a biodegrade product that's, in my opinion, very safe. Now, why do I use silicone over Restylane or other fillers? So let's talk about what's the biomechanics of an acne scar. The acne scar is this dermal. So there's epidermis, dermis, and there's fat. Restylane, other fillers are placed in the fat area. And where the problem is with an acne scar is there's a dermal etch. So there's this etch of the dermis coming down like this. It's tethered down and it's atrophic. So what I need to do is expand that dermis until it becomes relatively flat. If you inject it below into the fat layer, there's several problems. Well, it's drifting everywhere. The fat is not going to go anywhere, so you're not going to see a result. You're going to overfill the area. Plus, you may have heard about donutting and other effects where there's a tethering of the dermis down below the fat. So if you inject the fat, you can actually put pillars up and fillers around it, and it can actually worsen it. And that's the layer that Restylane goes into. Now, with silicone, the trick to not make it lumpy is to inject little tiny aliquots, little tiny amounts, done over once a month, and you come back and you slowly expand that. So what I'm doing is I'm expanding the dermis slowly to get now really, really good results. The Restylane, you can't do that. You put that into that layer, it's going to bunch up and it's going to create a Tyndall effect, which means you can actually see the see-through effect of it. Where silicone, I've just never been able to see it. It actually remains opaque. And what's interesting is, as I told you, I do a ton of lip reduction for silicone. So when I go in there, I open the lip, I look at silicone every week. I don't see balls of stuff coming out. I don't see liquid dripping out. It's fully integrated in the tissues. So So it's a very different understanding of this. And that's why I use silicone, because it's bio-inert, it's been safe for 20 years. I've injected it into just that dermal area. It's the only product I know that can be really safely injected into the dermis and gradually expanded to create the results. As I said, the best results are in those patients with a slightly softer shoulder rather than a very acute, abrupt shoulder like that. So silicone works really well. So I tell my patients that it takes multiple rounds to see a result. After one treatment, you typically don't see much difference. 85% of my patients go home not seeing a lot. It takes 2 to 3 rounds before you start seeing a difference. How many treatments do you need? In the old days, I said you needed 3 to 6 treatments, and I was getting B minus results. Still improvement, but now that I've had a couple patients that were very obsessive, pushing me to the limit, telling me to go to 10, 15, 16, 20 rounds, I have noticed insanely good results. I never get an A, but now I'm getting to A minus B plus zone because I'm able to stent that dermis to almost flat. And that I do them no sooner than 28 days or 1 month intervals that give that time for that area to continue to expand and soften. But that has been just a godsend, is now I'm getting results that I'm incredibly proud of because I'm pushing those limits much higher. Now it's harder if you live out of town because you're going to come in and fly maybe 10 visits to Dallas for me to do it, so it's harder if you're out of town. I have done it, and that's important you know that I can do from out of town patients. And you can fly out the same day, no problem, because it's an office procedure done away. I do a lot of vibration techniques. The lady I just did said, hey, that wasn't even that bad. So most patients with vibration techniques don't hurt that much because the vibration causes our brain not to feel the discomfort. I typically don't like to use numbing cream with this technique because what I've used in the past, sometimes the numbing cream causes a slight expansion of the skin, and it makes me harder to read it. If you're really scared of needles, I can give you a nitrous, breathable nitrous. It just makes you feel loopy, and that goes out of your system about 30 minutes. You can drive home, but 99% of people don't need that. They find it to be relatively not so uncomfortable for me to do the procedure. And so the other thing is, after 90 days, you get this bonus where it continues to improve. You get a little bit of collagen improvement. So don't give up after that last round. All of a sudden, 90 days, you get a little bit further improvement. The other thing important is that there's always going to be a lighting situation that's not perfect. I had a lady come to me going to the beach, and she said, oh my God, I went to the beach and it looked terrible. Well, there's always going to be this overhead lighting that just looks horrible, okay? And just remember that. I use exaggerated top-down lighting so that I can read everything with additional lights that I can use to further enhance areas. You can bring a flashlight. I have one gentleman from Austin that does that. But honestly, it's best to see a top-down shot for me to get a good view of what's going on with your scars. But understand that you could get a situation where all of a sudden bad lighting shows up, bad photograph, and you run back here. I've had that a few times. A gentleman from San Francisco, I was doing him for many years, and he was happy that I didn't see him for 10 years. He came back and says, I need another treatment. I said, why? He says, well, I got scared. I saw this bad photo of me. I said, look, you look great, okay? I showed him the before and afters. He was incredibly pleased. But we forget where we started, and that's really important, that should be ongoing improvement. The other thing is, we get older, our face goes from a convex to a flattened appearance. So sometimes acne scars appears to have gotten worse after 10 years. And really what it is just the face has gotten flatter. So when I re-expand the face, like with Restylane fillers, etc., I don't believe in big cheeks, but sometimes if it's 10, 15 years later, it's not the silicone issue, it's just the way the light is shining down off the face that doesn't look as good. I may have to just re-expand some hollow zones, but not always the case. That's just something for you to understand as well. The silicone is charged per treatment. I'm not going to talk about pricing on this video, but just so you understand, it's not the cheapest thing out there, and what you're paying me for is really my experience levels of doing the procedure. Typically, recovery-wise, most patients don't have a lot of bruising and swelling. I can't promise you that, but this is the reason why. If this is the epidermis, this is the dermis, your blood vessels are down here. So when I'm injecting the superficial dermis, it's far away from the subcutaneous blood vessels. So a lot of people don't swell and bruise very much with this treatment. And I think that's why also it's not as uncomfortable, because I don't have to go so deep with the injections, with the therapies. It is permanent. I believe that this is something very long-term for you to get a great result with this. I believe it's the best technique out there, but he said, well, Dr. Lam, is there anything else I can do? Well, I alluded to some of those hard situations. Hard edge or V-shape are very hard with acne scars. In those situations, I typically would probably use microneedle It's not a typical microneedle. It's not just putting needles or just a skin pen. It's a radiofrequency microneedle. And so I use the microneedle in 2 situations. One is the patient with scars that are very superficial, that I don't really think the silicone is even necessary. Or 2 is when those scars are not amenable to silicone. Very hard edges that I can't quite elevate the dermis well through injection. The third category actually would be someone that has gotten all the silicone is really down to the last final stages of it. Then they could come and just use the microneedle to finish it off. What the microneedle is doing, you can watch my video on that, is that the microneedle comes in, it locks in with a vacuum seal, because the epidermis is protected with a thermal protection, and then the radiofrequency tightens up the dermis, so over time it's building the collagen. And it's safe to do it after silicone, but I would be cautious. In a lot of places, they don't clean the skin well and prep the skin well. So I've never had a patient with an infection of the silicone, but that's something you need to know as a potential risk if you're doing microneedle in an unsterile situation. I had one lady, I remember the story, I was doing a treatment, did maybe 3 or 4 rounds for her. She was from Houston, and she went up to New Jersey, had one treatment, and it became lumpy. And it was not because of granuloma. What happened was the doctor just injected the wrong plane. Fortunately, I really know how to fix my own treatments like this, but what I did for her, I was able to fix it. I was able, through about 3 rounds, I took a hot tip cautery and just cauterized down those areas and flattened those areas. But that's why injecting into the dermal plane is so important, to get accurate injections, because the dermis is only about 2 millimeters. So I've done millions, probably, I don't even know, of individual injections. And my hand is just easily injected in the right plane. But if you inject too much, too superficially, or too deep, you just don't get the results, or you get an unsafe result. So that's probably all I have to say about acne scarring and microsilicone injections, and a little bit of microneedle. And I encourage you to watch the other consultation with microneedle to understand more about that if you wanted to.